An opioid is a type of drug used to reduce pain. An opioid emergency happens when too much of the drug overwhelms the brain and interrupts the body's natural drive to breathe. Opioid emergencies are a fast-moving epidemic affecting people nationwide, regardless of age, gender, or location. However, negative attitudes driven by stigma may hinder one from being prepared to help save a life. People may think, it could never happen to me, or I don't know anyone who could overdose. But chances are, they do. And even if they don't, they can still be ready to make a difference. An opioid emergency can happen to anyone, a child, a parent, a friend. It's time to change the way we think and talk about opioid emergencies. And it starts with a simple message. You have the power to save a life. An opioid emergency can be life-threatening and requires immediate intervention. Knowing the signs is essential to saving a life. These may include unusual sleepiness or unresponsiveness, breathing is slow or absent, slow heartbeat or pulse, skin feels cold and clammy, pinpoint pupils, fingernails and lips are blue. If you suspect someone is experiencing an opioid emergency, administer NARCAN Nasal Spray and call 911 right away. NARCAN Nasal Spray is available as an over-the-counter treatment designed to rapidly reverse the potentially life-threatening side effects of an opioid emergency. Know the signs. You have the power to save a life. Are you prepared to save a life? Opioid overdose is the leading cause of accidental death in the United States. Due to their effect on the respiratory system, opioids may cause breathing to stop. When this happens, brain damage can occur after 4 minutes, and death can occur 4 to 6 minutes later. It takes an average of about 10 minutes for emergency medical services to arrive, which can be the same amount of time as a potential overdose death. So it is crucial that treatment be administered as quickly as possible. Having NARCAN Nasal Spray on hand allows you to respond first and help save a life. Naloxone, the active ingredient in NARCAN Nasal Spray, is the standard of care for treatment of opioid overdose. But only about 1 in 5 opioid overdose victims receive naloxone prior to EMS arrival. Now, everyone has access to the same treatment used by emergency responders. Accidents happen. You have the power to save a life. NARCAN Nasal Spray is an emergency treatment designed to rapidly reverse the effects of a life-threatening opioid emergency. If you suspect an opioid overdose, check to see if the person will not wake up, is very sleepy, or is not breathing well. Do not test the nasal spray device before use. NARCAN Nasal Spray is for use in the nose only and is safe to use even if opioids are not present. Hold the nasal spray device with your thumb on the bottom of the plunger. Insert the nozzle into either nostril and press the plunger firmly to give the dose. One nasal spray device contains 1 dose of medicine. Call 911 immediately after giving NARCAN Nasal Spray. If the person does not wake up, continue to give doses every 2 to 3 minutes until the person wakes up. It is safe to keep giving doses. Stay until an ambulance arrives, even if the person wakes up. You have the power to save a life. For more information, visit narcan.com.